Additional vascular malformations and injuries of the head, neck, and spine. There are a variety of other vascular abnormalities of the brain, head, neck, and spine that are treated using neurointerventional techniques. Blunt injuries, typically experienced during severe car accidents or other trauma, including penetrating injuries, can result in a perforation or tear in the carotid artery near the base of the brain. This can cause a short circuit between the high-pressure carotid artery and the low-pressure cavernous sinus, known as a carotid cavernous fistula, or CCF. CCFs can cause severe redness and swelling of the eye, double vision, loss of vision due to increased eye pressure, a loud intracranial pulsatile noise known as a bruit, and pressurization of the cerebral veins, potentially leading to brain hemorrhage. Treatment of a CCF involves placing a small catheter into the affected cavernous sinus and filling it with small platinum coils and sometimes a glue-like material to occlude the fistula. A dural arteriovenous fistula, or dural fistula, is another type of short circuit between arteries and veins that can impact the function of the brain, eyes, or spinal cord. Like a CCF, a brain dural fistula can cause eye redness and swelling, double vision, intracranial bruit, loss of vision, and even intracranial hemorrhage. Spinal dural fistulas typically result in back pain, impaired muscle and sensory function of the legs that may progress to paraplegia, and loss of bowel and bladder continence. Dural fistulas of the brain are usually treated by transcatheter embolization, performed by an interventional neuroradiologist, also known as a neurointerventional surgeon. Spinal dural fistulas can also be treated, in most cases, with transcatheter embolization of the short circuit between spinal arteries and veins using a glue-like substance. Another condition that occurs in fetuses and newborn babies and is typically diagnosed during a prenatal ultrasound exam is a vein of Galen malformation. This congenital abnormality can result in head enlargement, severe and potentially fatal heart failure, and brain damage. These vascular malformations are usually treated with transcatheter embolization as well. Finally, there are head and neck hemangiomas that are congenital venous malformations causing irregular venous lakes within the subcutaneous tissues. These cause mass effect, deformity, pain, and, when located in the mouth and throat or oropharynx, can result in oral bleeding, airway obstruction, and sleep apnea. Neurointerventionalists treat these vascular lesions by puncturing them directly through the skin and injecting an agent that causes inflammation and clotting off of the treated portion of the malformation. The treated area may initially become severely swollen for several days to weeks, but then ultimately contracts to a smaller size. Several treatment sessions may be needed to achieve the desired result.